More than 500 protesters have rallied in Melbourne to oppose what they say is an attack on Medicare. The latest proposal to allow private health insurers to pay GP costs has many health bodies concerned too. Critics say a number of changes being considered by the federal government would lead to a two-tiered system, with the rich benefiting the most. Karen Percy reports.
Healthcare workers stood alongside pensioners and students to defend changes to Medicare.
This is an ideology that works against the interests of healthcare and works against the poor and the most vulnerable in this society.
The latest concerns centre on a trial underway in 6 Brisbane clinics operated by the Independent Practitioner Network. Medibank private patients have been promised they will have no out-of-pocket expenses, see a GP within 24 hours and be able to access after-hours home visits with no out-of-pocket expenses. Advocates of healthcare reform worry that GPs would raise their fees and private health rebates will rise too.
And that'll end up costing the taxpayer more because the private health insurance companies will raise their premiums to cover the extra benefits they're providing.
The Greens say it's against the spirit of the Public Healthcare Act, which specifically prevents private insurers from offering benefits for Medicare services such as GP visits.
This is a government that's taking us on a fast track to a two-tiered American-style health system, which is both unfair and unsustainable.
Medibank Private says it's offering enhanced GP services and is covering administrative costs, not doctors' fees. Other insurers are backing the trial.
Might cost more to compensate doctors for the additional effort and skill and capability that they would bring to those people, but hopefully on the other side of the ledger, you're significantly reducing cost and inflationary pressures in the system by getting better health outcomes.
Medicare is not for profit.
The protesters are vowing to stand up for the 45% of Australians who depend entirely on Medicare. Karen Percy, ABC News, Melbourne.